Hello again, everyone. My name is Marty Guthmiller, and I am CEO of Orange City Area Health System, bringing to you today on a Friday edition of our briefing, the 50th edition of our COVID-19 community briefings. I wish we didn't have to do 50 of them, but nonetheless, it is the 50th edition today. Our last edition was on Monday the 24th, so I will be giving some references to the numbers that we previously reported, and that, if I don't mention it, will always be Monday, August 24. So the information that I have today, again off the coronavirus.iowa.gov site, is as follows. Sioux County has 861 positives of the 5,401 tested. That is a positivity rate of 15.9%, which is higher than it's been. Previously, I've reported numbers of 15.1, and the time before that of 14.3. So there's no question that the positivity rate in Sioux County is going up. We've had 81 new positives since Monday. One of the things to remember as school begins and colleges are back in session again, 10% of our positives have been in ages 0 through 17. 48% of our positives are in the 18 to 40-year-old category. So one of my issues with this is that there's 58% of the positives in Sioux County are attributed to under 40 years old. One of the reasons that is significant is because that's the population that's best able to deal with the virus. And so that's a good thing in terms of if you have to have an age group that tests positive, you would rather have a younger group because of their ability to deal with it, as we've historically seen. More on our positivity in just a little bit. Region 3, the 20 counties in Northwest Iowa, currently have 28 hospitalized COVID-19 patients. That is a little lower number than we've had. The last time we talked was 29, so only slightly lower, but the time before that, 38. So 28 is heading in the right direction. 5 in the ICU is a better number than we reported on Monday. There were 6 in the ICU on Monday, and only 3 patients have been admitted in the last 24 hours in these 20 counties. One final statistic for Region 3 is that there is 1 COVID-19 patient on a ventilator in the 20 county region. Iowa statistics, again, going up. 62,031 positives out of the 618,253 tested. If you're thinking that that's approximately 10%, it is exactly 10%, 10.0%, as the website says. That is up. And to move that number up takes quite a few positives, obviously with a base of 618,000. The number previously was 9.5, and the time before that was 9.4. Hospitalizations in the state of Iowa are at 287. Our 2 previous sessions reported 263 last Monday and 278. So 287 is a tick up in the number of hospitalized patients in the state. Northwest Iowa hasn't changed as dramatically as that, but it is still higher. Sioux County, as an example, has 0 hospitalizations currently. O'Brien County, 1. Plymouth County, 1. Lyon County, 0. Clay County, 2. Dickinson, 1. Woodbury, 11. So the Sioux City market is up 3 from the last time we talked. Polk County remains number 1 with the Des Moines hospitals at 56 inpatients currently. That number is up from 49 when we talked on Monday. So hospitalizations are up, but I would point out that probably not proportionately to the number of positives. Talk more about that in a little bit as well. Deaths are up as well. 52 more people have died this week from COVID. 1,091 deaths in the state of Iowa. Sioux County remains at 3, so no change in Sioux County. The curve, when we look at the curve for the deaths in the state of Iowa, it's a relatively flat curve over the last 2 to 3 weeks. So again, we need to contrast that versus the number of positives and the acuity level as represented by hospitalizations. Any death is not acceptable. One additional death is one too many. But it is important for us all to understand that the curve on the death statistics is not going up. It's basically a flat curve, and in an era of increased positives, something to consider and factor in. Some of the demographics on the deaths, and I think this is important as particularly we are interested in what's going on in schools and our youth. The death rate is still at 89% at 61 years of age and over. So that number really hasn't changed much at all. It's been 88, 89% from essentially the very beginning. Remains 0% in age 0 to 17, and it is 2% in the age group of 18 to 40 years old. Another statistic that I've been giving to you over the last few times now is the percent positive 14-day average. Really gives you a little more of a snapshot, a glimpse in time of what's currently going on, and it's not watered down by the previous 4 or 5 months of activities. Not good numbers for Sioux County in this 14-day average. 17.5% positivity rate for Sioux County in the last 14 days. That number previously was 14.6, and the time before that when we talked was 11%. Sioux County is the 4th highest positivity rate over this 14-day average in the state. Plymouth County, by the way, is number 1 at 22.2%. Again, these are positive ratings, not necessarily reflective of the acuity level of the disease, of the COVID. There are 35 counties, 35, that have a 10% or a higher rate over this last 14-day period of positives in the state of Iowa. So 35 of the 99 counties at 10% or higher. Sioux County at number 4 at 17.5, Plymouth at number 1 at 22.2. I want to shift out of the statistics just a little bit and talk about Dr. Donlan's acronym, again, the ACAHS acronym. And I realize that for you, those of you keeping track, that I skipped the A, and simply didn't have time to go back and research some of the information on that. But I'm going to skip over today and talk about the H. The H, as you recall in Dr. Donlan's acronym of how to get through the COVID, was health. And the gist behind his suggestion was what I've been talking about earlier in my language of keeping your engine tuned. Everybody is aware that not only age is an issue with the COVID, our body's ability to fight off COVID, but the nature of our body, how healthy are we? And so keeping the engine tuned refers to maybe losing some weight, maybe walking or working out a little bit more. Perhaps it is lowering your blood pressure. Perhaps it's lowering blood sugars. Maybe it is getting that colonoscopy. Maybe it is making sure your wellness check is in place, making sure your children's vaccinations are up to date. To keep that engine tuned is the best weapon that we have currently and probably ever, even when vaccines are out. Keeping our body in as good a shape as we possibly can to be able to use our body's natural mechanisms to fight off viruses is always the best thing. So again, just a shout out to Dr. Donlin again for thanking him for the acronym. And one other thing I want to make sure we remember the mental health part of the health part of this too. We all acknowledge that the collective weight of COVID is manifesting itself in very different ways in all of our lives. But it is not the same maybe from person to person, but it is definitely there. And simply to be cognizant of that, to get out, to enjoy life, to control what you can control, to mask up when around folks, to practice good hygiene, and keep in mind that while positives are up, our acuity continues to be low. Even at 4%, or number 4 in the state in this 14-day average, we have 0 patients in the hospital. We hope that stays the same. We hope that we don't see another COVID patient in the hospital ever. But we have to keep that in mind, and maybe mentally that helps us all, and helps us to not live our lives in fear, and not to be doubt casting too much, but just try to keep that in mind and enjoy your life and enjoy your family. I'm gonna end today by our normal sign off of staying strong, staying vigilant, and again, above all else, to stay healthy. Thank you for joining us today.